And if I could ask Dr. Buchanan, so just currently, I believe that your website shows that about 900 people currently are COVID positive, which is like less than 0.2% of the population. So
I'll trust that you looked at those numbers, Madam Chair. I haven't looked at them today. So
yeah, but I look at it every single day, so I know the percentage. You can ask me any day, what percent of Knox Countyans have COVID? I probably know it. So at 11 o'clock, 11:05, I'm probably on there. So I look at it every day because it's important to me to keep up with what's happening, so that because I really think that a lot of people have a very misconstrued notion of how many people have COVID. First of all, I think, because I had an email today from I don't remember if it was a parent or I think it was actually a psychologist, somebody with a medical background, and she talked about that she's working with a child whose parents died, and they think the parents died of COVID, and they didn't. But like kids particularly have a vision that everybody has COVID. So I think even I've seen some surveys to just people on the street. How many people in the United States do you think have COVID? And it's people have a view that it's much higher than it actually is. So I think that's one thing, that there's been so much fear, and that people don't have a realistic view of how many people actually have had COVID. So over time, less than 10% of our population, here in Knox County has COVID positive. So right now, where we are at just a very small percentage, 0.19%, so knowing that and what the trend has been, what Ms. Bounds talked about with the trends, do you feel like we're getting to a point where we can get rid of the mask because of just this, that we're improving? What is the end game, I guess, is the question. Because, like Ms. Henderson said, everybody's done everything they've been asked to do, and yet it seems like it's not enough yet. So when is it enough, I guess, is the question. Here, and I think it's important that we look at local, what's happening here, what's happening locally. Let's make local decisions.
Well, unfortunately, COVID-19 determines the end game. COVID-19 itself changes, it mutates, we have variants, it's changing. The job of a virus is to survive and be passed on to somebody else. And COVID-19 is very efficient at that. So because of changes, I can't say to you on, July 5th, we're going to be able to take everybody's mask.
But I guess the question is it going away, or is this something that's just going to be here?
I think
like the flu?
I think we'll have cases of COVID going forward. It won't surprise me if COVID vaccine becomes part of the annual or periodic vaccines that we all get. That wouldn't surprise me at all. We are improving. It looks a lot better. Like Dr. Trout says, we're in a different place now. Vaccine is the key. And as a board, rather than focusing on masks, focus on getting your staff vaccinated. I don't know how you do that, but I don't know if there's a way for you to encourage them. But getting your staff, all of them, vaccinated, or as many as are willing to take the vaccine, is really the key. When we closed schools down during this past year, we seldom closed because of disease. We closed because of an administration decision, because there weren't enough teachers or enough, staff to have school. So those staff won't have to quarantine if they get vaccinated. It'll change the game for the schools and for your staff and for you. So it is better. Things are much better, and I'm thrilled. The schools have done an amazing job of keeping kids healthy and keeping them in school as much as possible. And it's been because of the things that we've had in place that we haven't had terrible, big, giant clusters throughout the school. We've had clusters primarily in your athletic department because nobody's wearing masks and they're all being exposed. Not many clusters in the classroom, which is good news. That's great. It shows that what they're doing is working. So I would still say following the CDC's recommendations is the best route. And the American Academy of Pediatrics continues to recommend masks at this time. CDC continues to recommend masks. But those are changing. I mean, they just came out with, if you've been vaccinated, you can do these things now. So the recommendations changed based on vaccination rates and disease rates. And so I can't predict, none of you can predict what it's going to be in August, what the COVID situation is going to be in August. So I would argue that what you're doing now, you still have the flexibility to change your policy, and making sure you communicate that with your parents, that it could change based on the situation, based on the local situation, based on the national recommendations, and so you have that flexibility built in already, I would think.
So do you worry at all about our students' mental health because of the effect that wearing this mask all day and the lack of interactions they have with teachers and students? I mean, do you worry about the mental health of our students? Because to me, the masks are an issue because of that.
Of course I worry about the mental health of our students. I live in this community. I have nieces and nephews who went to Knox County schools. They're all grown up now, and I'll have great nieces and nephews who go to Knox County schools. So yes, I worry about the mental health of our students. But I also have to consider the health of your teachers and your staff, and the health of those students who some may be vulnerable, and may have higher complication rates than others from COVID. So it's a balancing act. You guys are being asked to do a balancing act. We're being asked to do a balancing act, balancing disease and mental health, and what's the best thing to do to keep the most kids in school and keep educating them.
I guess I feel like if we have a vaccine and we've offered, Children's has been great to partner with us to make it so easy for our staff to go and get the vaccine. If people choose not to do that, that's their health choice, and they certainly have a right to do that. But they have the vaccine, they have a choice, so I feel like that has to play into the conversation because we've talked about the decreased risk. Our kids, it's basically 100% survivable for kids. So
It's not 100% survival.
well, 99.8.
Not 100%.
Well, okay, 99.8, I think is the number. But nearly, I said nearly 100%. So also, can you talk about what your thoughts are about contact tracing for fall?
Contact tracing will continue to be part of what we do, and part of what the schools continue to do. The schools have done a great job of contact tracing. And I spoke last time when I was here about how careful they are about determining who has to quarantine and who doesn't have to quarantine. They watch video. They are being so careful because they want to keep every kid in school they can, and they want to keep every teacher at school they can without putting anybody at risk. So we will continue to be doing some contact tracing. The guidelines have changed a little bit. Fully vaccinated folks don't have to quarantine, and some other things have changed, so that's great. Again, another reason to encourage vaccination among your staff. So we'll continue to do contact tracing as long as we need to, and I don't know when that need will go away. We contact trace for everything, not just COVID. We don't contact trace for flu, but we contact trace for a lot of things to reduce risk. And as our numbers go down, you're going to have fewer cases in school, therefore fewer people out in quarantine.
And I'm assuming that I know that the guidance recently changed to 3 feet instead of 6. Is that correct? I'm not sure that's what we're doing in schools right now.
6 feet is preferred, and the guidance on that is really kind of funny because it's also based, not funny, but it's based on, like in elementary schools, I think they're recommending 3 feet, and then in high schools, they prefer that you have 6 feet still because there's more transmission in those older kids than there are in the younger kids. So it's a little complicated, and it hasn't changed for contact tracing, though. They haven't changed the recommendation for contact tracing to be 3 feet. It's still 6 feet.
Okay.
So you're still considered a contact if you are within 6 feet of another person for more than 15 minutes over a 24-hour period.
Okay. Ms. Satterfield, you haven't had the opportunity to speak. Do you have a question for Dr. Buchanan while she's here? Okay, so we'll come back to you if that's all right. Do we have questions for Dr. Buchanan? Mrs. Henderson?
I want to go back to the masking policy a little bit. So I've spoken to leaders in the surrounding school districts to Knox County, as well as some private schools this week, and all of them seem to have more flexible policies. Some don't require them below 8th grade. Yet they've been in school all year. I know a particular school district that has not gone on red or all year long with kids 8th grade and under not masking. So how come their numbers are so low with flexible masking policies?
Well, I think honestly, every school has a different, uses a different metric to decide red, yellow, blue, green, whatever. So those metrics are different. Knox County Schools was very thoughtful and very thorough in deciding what their metrics would be. And so without knowing what their metrics are, I can't answer that question. How are they making those decisions? I don't have that information. So I can't answer the question, sorry.
Well, and I was looking at Texas and Texas and California have had a mask mandate. Georgia and Florida have not had a mask mandate, yet the trend is exactly the same. I talked to a private school this week that I think Knox County schools, I want to say about 6.5% of our staff kids combined have probably been COVID positive this year. This private school that I spoke with, their percentage without wearing a mask like we do, they wear them in common spaces, not in the classroom, is like 7.1%. So, the percentage is very similar. So it's interesting that the trends seem to be the same regardless of whether you are a mask mandate or not. Do you have any comment on that?
Sure, I would argue it's hard to say what it would have been without a mask mandate here, because we just don't know, because we have one. And our students and our staff have been wearing masks to protect each other and protect their families and protect our community. And that's what I have to think about. And so we don't have we don't have a crystal ball to predict the future, and I don't have a way to know what it would be like if we didn't have masks in Knox County.
Okay, thank you. Other questions or comments for Mrs. Babb?
Yeah, I wanted to ask a little bit, and this really isn't getting to masks, but it's more talking about, we keep just stressing vaccines, and I read one of the daily things that kind of talks about how many people are vaccinated. I'm thinking those are the numbers y'all know from Knox County, because I feel like those are very skewed. I feel like our numbers are so much higher. I mean, as an example, I know 2 of our board, me included, went through the vaccine trial, which were probably not counted in numbers that way. I probably have 5 other friends that went through Pfizer and Moderna trials. Of my friend group, I would say over half of them have gone out of the county to get their vaccination. And then I even know, like, one of the high schools in my district, before children started giving them, it was getting almost to be a problem how many teachers were leaving to go to other counties. So I feel like when we're looking at our numbers and we're even saying, like, Children's has given this many vaccinations, it's not, I'm thrilled to know those numbers, but I feel like it's not really reflective of Knox County and how many people really are vaccinated, because I'm getting to the point, like yesterday to get unblinded in my study, I had to get a vaccination, and I called Summit, and literally they're like, you can come today, tomorrow. It was like no problem to get a vaccination. So, it's like right now, if you want one, it seems like it's available to get it.
Yeah. And vaccine availability is really increasing, and that's fabulous.
Yeah.
So just back to the numbers. So the numbers that we use, so everybody who gives COVID vaccine is required as part of their CDC provider agreement to enter the vaccination information into their state's vaccine registry within 72 hours of giving the vaccine. And so we pull that information out of that registry. So we're not just looking at what we give, we look at it based on county of residence.
Okay.
So when we pull those numbers out, it's people who live in Knox County. It's agnostic to where they got their vaccine. We don't look at that. We just look at, do they live here? And that's how many people in Knox County who've been vaccinated. And they're supposed to enter those trial vaccines.
Okay, good.
They're supposed to enter those too. Okay. I'm not sure if that's happened, but they're supposed to. So we're really looking seriously just at Knox County residents who've been vaccinated by whomever they got vaccinated.
Okay, well, now I'm glad to know that and get that clarification, because I was like, God, I feel like half the people I know did not get their shot here. But when y'all are counting, you are counting number of residents that have gotten vaccination no matter where in the state they've gotten it.
Even if they went to North Carolina and got it, yes. We're
That's
counting all those people.
Thank
yes.
you.
You may have already said what percentage in Knox County at large have been vaccinated, but I don't remember.
I'm going to look at Catherine for a second. I know it's over 20% have had at least one dose of vaccine. Fully vaccinated is a lower number, but we're over 20%, close to 30%, I believe, which is fabulous. But it's sorry? Oh, 32. I should look at my data more often.
32% have been vaccinated?
Have had at least one dose.
Okay, great. Okay.
And that's great. And, it's a long way from 70, but we're getting there.
Good. Okay. Okay, other questions? Well, yes, Mr. Watson.
Thank you, Madam Chair. Dr. Buchanan, I just got 4 questions for you.
Only 4.
Yes, ma'am. And you started saying some of this, but if you can just recount just a little bit. Can you give a brief account of how the COVID guidelines have reduced or shifted since the start of the pandemic? Because one of the things that I have heard a lot from a lot of constituents is, when is this thing going to change? It's not changing. Things are still difficult and all that. But my observation personally has been things seem to have continually loosened up. So can you just give a brief account of how things have loosened
So
up?
are you talking about guidelines or?
So, yeah,
I'm not
protocols
clear.
related to COVID in Knox County.
Okay.
So,
So if we're talking about, so I'll just stick with the guidelines.
Yeah.
So, you know, at the beginning, you had to be a contact, it was 10 minutes or more. Now we're 15 minutes or more. That made a difference. So that loosened some things up, because that meant some people were not considered a contact anymore because they were not in that close contact. And, you know, just as we've learned things, you guys, you went back to school.
right.
You successfully had students in school learning, and students didn't have to stay home. I didn't realize there were so many school districts across the country where they were virtual the whole time. I just didn't know that. And so I applaud you all in the school system and the superintendent and his staff for getting kids back to school. That's part of relaxing things and doing different things. You know, we had a stay-at-home order. We don't have a stay-at-home order anymore. People can go out to eat, and go grocery shopping and do the things that they want to do. You guys are playing sports. You got to play sports this year. And you got to have other extracurricular activities this year, which you did. Some of those you didn't have last year. So, I mean, I think we've really loosened those things up and changed based on the data, based on information that the CDC is gathering. Knowing that vaccines are effective, we now can say if you're fully vaccinated, you don't have to quarantine. We couldn't say that before because we didn't know how effective the vaccine was going to be going forward. So all of those things change. I think they're talking about extending how long they think you have protection. If you have disease, how long you're protected against getting sick again, from 3 months to 6 months. So as the evidence rolls in, they change the guidance, and we've changed as a community based on that.
Yeah, I don't know how everybody else in this room feels, but I know the first 2 months of the pandemic, I don't think I left my property very much, unless it was, I mean, I happened to be able to work from home. I had the privilege to do that. But, I mean, I feel like I feel fairly free in the way that I'm navigating the community. Let me ask you so one question you answered at the same time, so you just got 2 left. So one of the things I've heard a lot from all kinds of folks is that masks don't work and kids have a very low rate of transmission. Is that true in your mind? Okay. And if so, if it is true, why would we continue to mask kids in school?
So masks do work, absolutely, there's no question. That ship has sailed. Okay. Masks do reduce risk and decrease transmission for adults, for kids, for everybody. This is a respiratory disease. You put a mask on there, on your face, and you keep from having droplets go in or out. So they do work. As far as children transmitting COVID, there's some new data suggesting that they may transmit at the same rate as adults. I don't think that's finally decided. I just read something the other day that's suggesting that children may transmit as much as adults. And I don't know, Dr. Childs might have more about that, but I think that's still being looked at.
Okay. And then my last question is, and this is a legitimate, full of integrity question, because I'm as confused as a lot of other people. And I'd love to have somebody here from the CDC, but nobody would come at my request. So I want to ask you this question. Why at this point, and I know the CDC is a federal organization and we're looking at Knox County, why at this point in the pandemic, in your mind, is the CDC still officially recommending, and I know we're not suggesting a change for this school year. I don't think that's what the board's doing. It's looking for next year, which a lot of things can change. But why at this point in your mind would the CDC continue to recommend masks in schools when we are at this place in the pandemic and we do have access to vaccination?
Well, I think because one, vaccine, though it's easier to get than it was, we still do not have enough vaccine.
That all loosened up pretty quick. I mean, like now,
Well,
everybody in 16, I mean, like recently it
Right,
loosened up.
it did loosen
Yeah,
up, yes.
yeah.
But we don't have enough vaccine to vaccinate everybody who wants to get vaccinated yet.
Right.
We will eventually. So until we have the ability to really have vaccine available to anybody who wants to get vaccinated, I think we're going to still have to keep some guidelines in place. And, you know, I'm fully vaccinated, but when I go out or when I go somewhere, I'm going to wear this mask because I don't know if you live in a house with somebody who's elderly and I might make you sick and you take it home to them. So I don't want to do that. So that's why they continue to recommend masks. I think we've got to reach a better level of vaccination. Across the country, globally across the country, you're still, at least one dose of vaccine, you're still in the 30 percentile. So we need to get that number higher.
So, Dr. Buchanan, your mask is stylish. Do you like masks?
No, I don't like
Okay, so I want to make an observation, and I could be wrong, but I'm pretty sure that everybody who's spoken to this issue tonight, including you and Dr. Childs and everybody on the board, I don't think anybody likes masks. I mean, I don't know anybody who does. And what I've also consistently heard is that everybody is in agreement that vaccination is the end game. Is that correct? I mean, that's what we need to do is get more people vaccinated.
Yes,
Would you? Okay, thank you.
sure.
Okay, any, Ms. Bounds?
Okay, I'm a little confused here. Just help me out. So you had COVID, you're fully vaccinated,
Yes, ma'am.
and you wear a mask so you won't give it to anybody else?
Yes.
I really don't understand because my medical professional,
Allow me to explain.
okay.
There is still a slight possibility that I could contract COVID again. I wouldn't be sick at all, but I could transmit virus into the air and make somebody else sick.
So what are the
We
odds?
need more data on that.
So, yeah, what are the odds of that? I mean, I don't find a lot of information out there where people have had, there are people that have, I'm not denying that, but multiple cases of COVID. Like,
We've had
what is the
folks-
data on that?
We've had folks get reinfected in Knox County, and in Tennessee, there have been fully vaccinated folks who contract COVID as well. The cases are not very serious. They don't result in hospitalization, but they're mild cases. So the people with the mild cases are the ones who are more likely to transmit disease to others because they go about their business. They don't feel sick. They aren't sick enough to stay home, so they go about their business. And until the CDC guidance changes on that, I will continue to wear a mask as long as I don't know the situation of the people around me.
So there's no end. Okay, thank you.
No, there is an end. I mean, there is an end. Just right now, we don't have enough people vaccinated. That's our challenge.
Here in Knox County. That's when we quit. I didn't mean to interrupt you, but some people believe that when the last person, you know, as long as we have just a handful of cases, we should still all wear masks.
We'll see what the CDC's recommendations are at that point, sir.
Okay, Mr. McMillan, did you have a question for Dr. Buchanan?
Yes, but let me.
I know Ms. Henderson also has one.
You were first, Mr.
Yeah, go ahead, Mr.
Please
McMillan,
go.
then we'll go to Ms. Henderson.
Okay, Dr. Buchanan, I've just got, well, I had four. Ms. Bounds asked one about the continuing to wear a mask after you'd had the vaccine. I would think the odds would be extremely high. You know, I think it's more of a personal preference after 30 days passes and you've had the second vaccine, no matter where you go. When you contacted the vaccine, did you contact Trace?
I'm sorry, I don't understand the question.
Did you contact Trace where everybody that you had come in contact with?
My staff did that, yes, sir.
The staff did it.
No, our contact tracers, yes. Just I was treated like any other case, sir.
Roughly how many people did they come in contact with?
It was very few. I don't know, and I'm sorry, I don't remember.
Okay. All right. This is a yes or no question. Do you believe the CDC has become somewhat more politicized in the last 30 to 45 days?
Actually, sir, I believe it's been less politicized in the last 30 days.
Less?
But that's a matter of opinion.
Okay. Yeah, it is. Okay. But I'm glad to hear yours because it tells us something about what you're thinking, in my opinion. One last question. You remember when the UT students lined up, they were on TV, all lined up trying to get in bars over there?
Yes, sir.
Did you and the mayor of the city, Ms. Kincannon, did you all make any effort to do anything about that?
So what we did is my staff who inspect restaurants and bars worked with those owners to help correct those situations and educate them and advise them. You'd have to ask Mayor Kincannon what she and her team did in regards to that.
How long did it take for it to stop, for your staff to get it stopped?
I don't think we were successful in stopping it. Changing human behavior is quite challenging.
Okay, so I guess if you weren't successful, then the authority lies with the police department under Mayor Kincannon, and apparently she chose to ignore it because, to my knowledge, there never was anything really done about it.
Again, that'd be a great question for her police chief or Mayor
Okay,
Buchanan.
all right, thank you.
Sure.
Mrs. Henderson.
Thank you, Madam Chair and Board. Dr. Buchanan, thank you. Help me understand this. So I go to the gym every day, multiple gyms, and I wear a mask inside, but once I'm at my equipment, I take that mask off. When I'm at a restaurant, I walk in, I wear a mask, but once I'm sitting down, I take my mask off. I'm breathing, I mean, when you're at a gym, you know, let's be honest, I have my mask off, you're breathing heavily, but you're in the building with a ventilation system. What's the benefit of wearing that mask walking in if I'm taking it off if I'm sitting at a restaurant or working out at the gym every day?
You're just reducing risk to others around you and reducing risk to yourself. That's what you're doing by doing that.
Okay.
You're
I still don't
reducing risk.
understand. We're still breathing the same air, though, in that same building that I wore a mask in and now I'm not wearing one. I'm still there if I'm sick or not sick, breathing without a mask.
It's just risk reduction. That's what it is.
Thank you.
Mr. Watson.
Thank you, Madam Chair. Dr. Buchanan, one last question. How have you seen, and I know causality is a little difficult here, but how have you seen COVID guidelines, protocol related to COVID, have a positive impact on public health in Knoxville in general? So in terms of, have we seen a reduction in flu? Have we seen it? How do we connect some of the positive things we've been doing around public health in terms of how it's impacted public health in general in Knox County?
So, yeah, that's a great question. So, yes, our flu numbers are the lowest I've ever seen them in my tenure here at the health department for 17 years. And respiratory visits at Children's were down, and all our hospitals were down for other types of respiratory illness because of all the things we're doing to reduce the risk of COVID.
So, and I think this is really important to say, and I think a lot of people that are out here that are cheering would understand why I'm saying this. There is no doubt, and it's been stated tonight, that the pandemic has had an effect on our mental health, correct? As a community, as a society, as a world. But we've also seen it have some of the things that we've done to mitigate COVID have a positive effect in terms of overall public health, right?
Sure.
Is that true?
Well, in some areas, in infectious disease.
Right.
That's really where you're going to see that.
Yeah. So I think I only say that because I think what you stated earlier is everything in this pandemic has to be weighed. And I don't think anybody is for increase in negative mental health, nor is anybody for increase in physical health. And so it is this, and I think that's the tension that everybody's hearing in this board is that there's no universally accepted, this is the right risk factor that we have to use here. So anyway.
Okay. And does natural immunity to this come into play? So if 30% of people have been vaccinated, if another, 10% have had COVID, then there are some people who may be naturally immune. So I've heard maybe around a 70% herd immunity. Is that generally accepted? Is that the goal? And are those things being factored in? Can you talk a little bit about that?
So natural immunity from this disease we don't believe is long-lasting. So we believe the science tells us that vaccination is a better way to achieve immunity to COVID. Sorry. So we're not sure how long natural immunity lasts, and we don't think it's as lasting as vaccine. So for that reason, we're relying on vaccine for herd immunity, and we do want to reach 70 to 85% of our population with vaccine. So we do have quite a ways to go. Certainly folks who've had disease and are in that window of 90 days where they're unlikely to get reinfected, those folks do contribute to the herd immunity for those 90 days.
Okay. What, do you have, I know one of the studies that I saw, that it was actually on the CDC website, this was in regard to non-pharmaceutical measures for pandemic influenza in non-healthcare settings, personal protective and environmental measures. So there was a paper to that effect. And it states that proper use of face masks is essential because improper use might increase the risk for transmission. So, you know, I think, and I don't know if you're familiar with this Swiss, the Swiss Research Policy organization that it's a nonpartisan Swiss, what is it? They gather together, Swiss Policy Research, founded in 2016, is an independent, nonpartisan, and non-profit research group. So they have lots of different studies on their website, and I believe this is where this was referenced. So they have a lot of data on their sites about the effectiveness of, or lack thereof, of face masks. And so one of the, a few of these studies have indicated that you could have increased risk because, and I'm thinking particularly with regard to children, because if you have children who are, their mask falls to the bathroom floor and they put it on their face, or they, sneeze in it, or they wipe their dirty hands on it, whatever, all kinds of disgusting things that you can think of. So the CDC's website says proper use is essential because improper use could increase the risk for transmission. So I think that, to me, as a parent, I think that that's what I've heard from a lot of parents who are concerned about that issue. Their kid is wearing this nasty, dirty cloth on their face. So, I think that, I just wonder if you have any response to that, because I think we have to look at, people are responsible for their own individual health. So you have to look at the health of that child. Is that healthy for the child?
So it's our responsibility as adults to teach children how to do the things they need to do. We teach them how to wash their hands. We teach them how to brush their teeth. And in this instance, children now need to be taught the proper way to wear a mask. It's part of our responsibility as adults to do that for our children and help them learn how to do that properly and protect themselves. And yeah, sure, people who don't wear masks properly, they're at risk. They're putting others at risk for sure. But, it's our responsibility as adults to teach our children those things, and we teach them all those other things. Right now, during COVID, we need to teach our children about wearing masks.
Okay. Thank you. Mrs. Henderson, did you have another question?
Yes, thank you, Madam Chair and Dr. Buchanan. Just to follow up on that, when I wear my mask, I play with it about 50 times a day, where normally I would not touch my face at all. But so back to the vaccinations, we know that not everyone will choose to be vaccinated, and that's their choice. But at what point do you think, what number to you is a good percentage of, okay, now we can let up on some more of these restrictions? What's your magic number?
There's no magic number. The recommendation from the CDC is 70 to 85% of your population needs to be vaccinated. We may not get to that, but when we know we've saturated the need or the desire for vaccine is when we have ample vaccine and nobody's getting vaccinated. That's when we know we're done, because people have either chosen to get vaccinated or they haven't and they're not going to. And so that's when we know we're done. I don't think it'll be at 70%. We don't get those numbers for flu shots, and people are really comfortable with flu shots. So that's how we'll be able to see that as a community when we have vaccine that just doesn't get used. Right now, we're not in that situation. I know it's not that hard to find a vaccine appointment right now because it's improving, but we certainly haven't saturated the market of people who want the vaccine. And then there's some people out there who are still going, I don't know, I want a few more people to get vaccinated before I do. And those folks need to get vaccinated as well. And then we've got all our children who hopefully vaccine will be available for them, and we need to get them vaccinated as well. So it's really, there's no magic number. Those are the numbers recommended by the CDC. I'm skeptical that we'll get there just because I'm looking at flu data. I'm not sure we'll get there. But we do need to have that opportunity and have enough vaccine in our community for anybody and everybody who wants to get vaccinated, and our kids to get vaccinated as well.
Thank you.
Thank you. Anything else? Thank you very much for being
Sure.
here. We
Thank you.
appreciate your
Thank you for the
time.
opportunity.
Thank you.